This is the Chapter 5 lecture, and it covers population health. I really love this chapter. It is dense, as many of the chapters are, but there's such important information in here, so I encourage you to give it a read, take lots of notes, read it again, etc., etc. When we think of healthcare, we often think that it is the most important influence on our health, especially in a course that covers the healthcare system, that our access to healthcare, the quality of our healthcare, is the most important determinant in how healthy we are. But as a matter of fact, this is not true. Other determinants weigh heavier, and we'll look at that. Other determinants, as you heard about in the podcast, impact our health, and they include things like education, our income, our genetics, our behaviors, the environment in which we live. The population health model studies the causes of systemic differences. So it looks more at the big picture, but how that big picture impacts the individual. By studying these causes, it can analyze health patterns, identify factors, and then use those factors to create interventions. Sometimes this is described as upstream causes, and we use the term determinants instead of causes, and there are certainly multiple determinants of health. The population health model examines these multiple determinants. As part of this, there's something called reverse causality, and be sure to read about that in your textbook. You should understand that definition. The medical model, which is traditionally the model that has been used in this country, is very, very different. Your text spends a lot of time kind of contrasting one model to the other. This focuses more on the micro level, on the individual, on the pathophysiology. It also tends to be reactive to disease rather than preventive of disease. What we know and have clearly shown in our reading so far is that we spend lots of money on healthcare in this country, and yet our life expectancy and many other indices of health and well-being are lower. We spend more, we get less. And that then more or less dispels the notion that healthcare is the sole determinant of health. So let's look at those two models for a minute, the medical model and the population model around obesity. This is what typically happens in the doctor's office, and you can see that here. But the population health model is very, very different. It focuses on the epidemic. It focuses on risk factors. It focuses on reasons that individuals are not able to comply with healthy behaviors. It focuses on policy changes as well and the impact of those. When we look at the causes of obesity, from the population health model, these are things that impact lots of people and are societal and often structural. So definitely take a look at all of these factors. Lack of grocery stores, lack of places to safely be physically active, not enough time to run in school. This is what the population health model addresses, examines, and then addresses. Same thing for tobacco. Your text does a very good idea what typically happens in the doctor's office, but how do we look at this from a bigger level and then intervene? So the influence of social determinants on health behaviors and outcomes is significant. Your textbook goes through research, early research as a matter of fact, which showed that with gradients in societal class, there was actually an increase in health status. We look at the impact of stress and neighborhood effects, as was described in the podcast for Chapter 5. There are predictive factors of life expectancy that should not be predictive. What kind of a world do we live in where your income or your education determines how long you live, where your race determines how long you live, your gender? And we see when we study gradients within gradients, take time to look at this chart. Higher is worse. Percentage in poor health, and you see stark differences with different ethnicities, but also within one ethnicity, you also see a gradient or gradients according to education level. So again, there has been a lot of research on this, a lot of interest in this as we have these mounting healthcare costs, and also some effort to weigh these different determinants as well. This is one group that attempted to weigh these different determinants, and although there's nothing that's perfect, this is so interesting. So McGinnis and Foge found that only our health was only 10% determined by our medical care, but behavioral factors had the strongest influence. Then genetics, you see, medical care rather low. This is another study. I just think this is so interesting. When you're addressing the health of a population, if you only focus at what happens in the hospitals and the doctor's offices, you're missing the biggest piece of this. In this ranking, social and economic factors like education and employment and income, that had the largest influence on morbidity and mortality. Think about that. Health behaviors next in line. So what this means is that we need to perhaps spend some money in these areas, but right now only 5% of our expenditures on healthcare are spent on preventing diseases. We are a sick care system where most is spent reactively on the crisis, on the disease. 2/3 of our expenditures are spent on treating preventable diseases, and yet only 5% is spent on preventing those diseases. So very important. Policies need to be reconsidered. The structure of our healthcare system needs to be reconsidered so that we are addressing the factors, the determinants that have the largest impacts on our health.